The topic of conversation is Parkinson's disease. Dr. Eleanor Orehek is with us. Noran Neurological Clinic and Abbott Northwestern Hospitals is her affiliation. Good evening and welcome.
Thank you. Happy to be on.
Did I say that right? Is it the Noran Neurological Clinic?
Yes, that is right.
Okay. Well, it's, some might say the Noran. So, as we all get a little older, in our circle of family and friends, we probably know someone who is dealing with Parkinson's disease, might have recently just been diagnosed. And of ourselves, I think people start to question, am I coming down with Parkinson's, or is, my partner or whatever. What is Parkinson's disease? Let's start there.
So Parkinson's is a complex disease, but it's what we call a neurodegenerative disease. So meaning it's a disease that affects the brain and it's progressive over time. And it's the second most common behind Alzheimer's disease. And there's up to 60,000 people in the U.S. that are diagnosed with it each year. So it certainly does, like you said, affect a lot of people.
And who's at risk of developing it? Is it something that is passed on through genetics? Are there certain environmental conditions that might, aggravate it or bring it on?
Those are still good, tough questions. In general, it's what we consider a sporadic disease, meaning there isn't a clear genetic cause to it. So there's about 10% of patients that have more of a genetic link, but we are learning more and more about the genetics the more testing we're doing for people. And other risk factors, age, as you meant, as people age, that's certainly a risk factor. Men have a little bit of an increased risk over women. And
pesticide exposure, that kind of thing. Sure, that makes sense.
Pesticide exposure, repeated head trauma. There's other things environmentally that we're looking at, but there's still not anything concrete as far as these things definitely cause it.
What about diet? What about alcohol consumption over the years and decades?
Alcohol certainly isn't good for the brain and the brain cells, but that's not necessarily considered a specific risk factor for Parkinson's disease.
And what are some of the early onset symptoms or things that people notice? Because one of the things I've always heard is like your penmanship starts to change, or you find yourself unable to even write a check sometimes because your fingers shake, or you just don't have the dexterity anymore to make like a simple letter in printing.
Yeah, so some of the symptoms can be more noticeable. So tremor certainly is something that would alert someone to possibly having Parkinson's. But you have to be careful because Parkinson's and tremor aren't synonymous. So if people can have tremor that's not Parkinson's, and vice versa, you can have Parkinson's without tremor. So you have to be careful about that. But certainly having any shaking in the hands would be a sign. But other symptoms are more subtle and they progress really slowly. So people kind of adapt to them, and it can be hard until it becomes more pronounced, where you have the small handwriting like micrographia that can be part of it. And some of the slow, like changes in walking is something that people notice a lot. So more shuffling of gait and decreased arm swing certainly are things that either the person themselves or a close partner or spouse, those people will start commenting on changes that then will have them talk to their doctor about it.
Well, one thing when I was getting ready for this interview was I was noticing, and you mentioned this with regard to the tremors, you can have like a tremor condition that has nothing to do with, preceding Parkinson's. It's right. That's a whole nother deal. Is that treatable, or how does somebody deal with the tremor, and what causes that?
Well, another common form of tremor is called essential tremor, so that can be familial. That also increases with age, and that's more of an action tremor, so people shake, kind of like Katharine Hepburn had a bad case of essential tremor, so it can start causing head tremor and hand tremor, and that it can be, there's medications, or there's a brain surgery called DBS that we can use to to treat that form of tremor, but it can be really challenging and really debilitating for some people to treat it.
And how does exercise play into, dealing with or trying to improve your condition if you are battling or heading into Parkinson's?
So, yeah, I mean, that's kind of one of the main things I talk to people about. If we're suspecting Parkinson's, or if there's for sure a clear diagnosis of Parkinson's, that's kind of like what number 1, 2, and 3 on my list of treatment plan priorities. So, for sure, exercising regularly is good for all of us, but really important in Parkinson's, and the evidence just keeps building for that. So that's definitely
what kind of exercise are we talking about here?
Yeah, I mean, that's a good question. There's not really a clear cut, you have to do this type of exercise. So I tell people to find things that they enjoy, maybe try new things, and try to do something that's more intense, at least 3 to 4 times a week, where you're getting your heart rate up. So we talk about biking. Boxing's been popular with Parkinson's, doing boxing classes and walking, anything really that you enjoy. And
yeah, I saw Leslie Stahl's husband on 60 Minutes is dealing with Parkinson's, and he took up boxing, and it did bring a significant improvement in his situation. I found that ironic because we just talked about, blows to the head. So,
yeah. So you're punching a bag, not each other. So
exactly,
part of the key.
Sure. Now,
but,
is there a medical or a pill treatment approach to Parkinson's?
Yeah, definitely. So when we talk about treatment, there's kind of a variety of things, and so making sure that you get all the pieces in place. So exercise is one piece, and then medication options is another piece. And one of the big problems in Parkinson's is you don't have enough dopamine in an area of the brain, and so a lot of the medications are focused on trying to increase dopamine and improve the brain signaling that comes from the loss of dopamine. So the medications, if taken correctly and at a good schedule, and the types of medications can be really effective. So with being on the right regimen of exercise and medications, people can live really well with it for several years. So,
Dr. Eleanor Orehek is with us. She's from the Noran Neurological Clinic and Abbott Northwestern. It's late at night, it's after 9 o'clock.
Right.
My speech starts to go. What about with regard to the progression of Parkinson's? How long does a person, have for quality of life before it really starts to take over?
Well, and that's a tough one too. I mean, people live with it for 20 years or more, and some people are able to maintain. I mean, I think when you get in the 10 to 20 year range, it certainly becomes harder to live with a significant quality of life, but it's manageable. And then we talk about doing things like brain surgery and changing the medications and trying to modify things to keep people doing as well as they can. But It can become more and more challenging.
One of the questions that you have here on your list here is, when does Parkinson's become deadly?
Mm-hmm. Well, Parkinson's itself isn't deadly, but it does increase the risk of having complications that can result in death. So we talk about fall risk and try to prevent falls, because if you fall and break something, then that can cause problems, and swallowing difficulties that causes liquid or food to get into the lungs and cause pneumonia is one of the more common causes of people having complications that can lead to death. So those are things we try to avoid and catch early enough so that we can modify and prevent that. But
well, let's try to end this conversation on a positive note here. What advancements are being made when it comes to diagnosis and treatment of Parkinson's?
So there's a lot. I mean, our understanding of the disease has gained a lot of ground just in the past several years. A lot of it's because of our understanding of the genetics of it, and so that's helped us target different problems that might go wrong. So there's advancements in DBS that are coming coming along, and diagnosis is still tough because we're trying to figure out the appropriate markers that we can test and measure for. So it's largely clinical at this stage, but we're trying to find, is there some blood test or spinal fluid test or imaging that is going to give us a clearer understanding. So there's progress being made there, but we still don't have anything clear cut yet. And then there's treatments for the disease that are being advanced, like trying to target the actual things that go wrong in the cell and the abnormal proteins with a vaccine type of treatment, or that kind of route to slow or stop the progression. So there's promise in the future.
Do you foresee a day where we're going to be able to, look at somebody's genetic makeup and see predispositions for these things, and more importantly, especially with the advancements in artificial intelligence and data crunching capability, that a certain regimen will then be prescribed specific to that person's situation of what may onset in 5, 10, 20 years from now? But if you act now, you can really start to offset that.
Yes. I mean, I think right now we already have the capabilities of testing for some genetic mutations that we know are risk factors. The problem is that we don't have a lot that we can tell people to do about it. So I think the more we learn about the disease and then target those abnormalities, I do see that in the future, because there's a lot of different variations within Parkinson's, and so the more we learn about, well, why does this person have tremor, and why does this person have more problems with walking and balance, and are there different treatments or different ways we can target treatments differently so that people are treated more specifically for their type of Parkinson's. And I think that is in the future, but probably a ways off when we get too individualized as far as genetics.
Sure.
But
well, this has been
kind
very
of an exciting thing to think about.
Yeah, very, very enlightening and very interesting. Dr. Eleanor Orehek with the Noran Neurological Clinic in Abbott Northwestern. Thanks so much for joining us.